My name is Heather Gates. I'm calling in from Newfoundland and Labrador. I'm the provincial breastfeeding consultant for my area, my province, but I have the pleasure of being co-chair of the provincial territorial BFI working group of the BCC. So I'm really happy to be here today introducing our guest speaker, Naida Hawkins. Naida is has a Bachelor of Science in Nursing, is an RN, and is an IBCLC. She is a passionate registered nurse with 14 years experience. When Naida became aware of the power of prenatal hand expression, she left her public health nurse job in order to make her primary focus getting this life-changing practice to more families and healthcare providers. Naida lives on a farm near Wilkie, Saskatchewan, where she farms with her husband and since the pandemic has homeschooled her 2 children. Naida is especially grateful to her family for all they do to support her calling. Welcome, Naida. It's such a pleasure to have you today. And before you begin, I'd kindly like to ask everyone to mute their line so there is no interruption. And of course, Naida, if there is a question period after, you can certainly announce it then, for sure. So take it away, Naida.
Thank you for that beautiful and warm introduction, Heather. Heather and I sat together at a table at the BFI Symposium in Yellowknife years ago in 2019. And so it's especially wonderful to be welcomed back by her because our project was just really, project program was very beginning stages and it's grown so much since we last were together. So thank you. I also wanted to thank everyone for joining us today. It is such a special week with Breastfeeding Week, but it also is, I understand, a very busy time continuing for all of us. And so the fact that you've taken time out of your day to join me is not lost on me. And I'm very, very grateful for the opportunity to share our amazing work with you. I am going to start because I, like Heather, sometimes struggle with sharing videos. So we're actually going to watch a video first up, which is going to be like my whole talk condensed into 3 minutes. It's also available on YouTube. So we're going to just give me a second to bring that up.
So we're very fortunate today to be joined by a mom who's ready to start her journey of prenatal hand expression. And in actuality, she's already done it for a little bit of time, so has some quantity to share with us. So it's important to wash your hands anytime you're going to do hand expression, which mom has already done. And then start simply by waking up your breast. And so we're going to see mom just going all around the breast with different techniques. She's going to do some rolling and some tapping. All of those are good to try because everybody's breasts respond differently to different stimulation. And the more things you try, the more you're going to learn what works for you. So after about 30 to 60 seconds of going around her breast, she's going to start the technique of pushing into the breast, so behind the nipple and then together. And so we're never on our nipple because remember from some of our other videos, we talked about how the nerve that services the nipple is very sensitive to pain. So we want to always stay off the nipple and are into the chest wall. So you see mom pushing in and then together and pushing in and then together. And you'll notice that actually she doesn't get colostrum right away. And then eventually you see the colostrum come. And colostrum can be any range of colors, green, even to a bit of a tinge of brown, because as breast tissue has been waking up, there might have been a little bit of blood. And so it doesn't mean you need to discard it. It just means that a whole range of colors are completely normal for your colostrum. So once mom has the little bit of colostrum coming out, she takes the syringe and literally uses it as a vacuum to suck it up off the nipple. So remembering that once she's collecting, she's doing this even 4 times a day. So she might only fill a quarter of the syringe the first time she does it. But she can use that same syringe and place it in the fridge in between. And then at the end of the day, label it and freeze it to be ready to take to the hospital. The other concept that this mom has agreed to help us demonstrate is what spoon feeding would look like. So we talked a lot about how you will practice breastfeeding, but also doing spoon feeding to help get your milk in the first 3 days. And so this mom is showing us how you would harvest onto a spoon, and then all you would do is squeegee that under the baby's top lip. And that's a very powerful tool to use if you have a very sleepy baby, because often if you do just a little bit of hand expression and get some food into them, they actually wake up and do a really good feed. So I'm very grateful to this mom for helping us, and I hope that you have found this video to be really helpful.
So that video is very, very powerful because it talks to prenatal hand expression. So when we were first talking about our program, what we were very cognizant of is every video that you saw of hand expression was often of women who were had their placenta delivered. So they had copious amounts of milk coming out when they were hand expressing. And that was very, very because we know that the amounts are very small when we're collecting prenatally, it was very kind of off-putting, and it just gave unrealistic expectations of what you would collect. So I hope that you have gotten that. The other thing I wanted to mention with that is that it is very exciting that we have translated that and dubbed it into Spanish, and we're just finished. We did French at the same time, but French took a little bit longer because of some technical things. So that is it's very exciting that those are available in French and Spanish, as well as our instruction leaflet that we put in our kits is available in French and Spanish. We had the blessings of presenting this most recently at La Leche League's World Breastfeeding Week in the US in August. And so it was fun to tell them our little difference of where we present in October here in Canada for our breastfeeding week. And when we went to the US, it was very wonderful because 2 other people who are very parts of this organization, Dr. Yan and Dr. Prolius, who are both obstetricians. So it's a very cool program that we have 2 obstetricians that come with us. They both send their regrets. Dr. Prolius was really hoping to come, and then he got called to a morning. So they both send their regrets. So here where we live in North Battleford, Saskatoon area, we're on Treaty 6 territory and homeland of the Métis, and we pay our respects to the First Nation and Métis ancestors of this place and reaffirm our relationship with one another. Recognizing this history is important to our future and our efforts to close the gap in Indigenous peoples. So you feel free to connect with us. If you take a picture of this with your phone, it's going to take you directly to our website. So you can browse some of our content if you're kind of a multitasker with going through that. So you're going to be treated today to some beautiful pictures that were taken by a group of mothers from the Onion Lake Cree Nation, and they put together a hand expression book, and what they have done is give us permission to share these photos with you. And if you have interest in purchasing this book, I would ask you to contact me, and I can put you in contact with the project coordinator for that. So I am so grateful to these mothers. Onion Lake is about 2 hours north of North Battleford, and so it was a real blessing to see these mums. So More Milk Sooner recognizes that our parents have diverse gender identities, and we aim to be gender inclusive. We're still learning. Please know we use gendered language in our presentation, and that we are welcoming to all families to come on this journey with us, and we really believe we don't want to leave any parents behind. So disclosure, this is something I like to put out there because it's not always known, but our website, we offer kits for sale at cost recovery clinics. to help them. We also offer kits for individual sale to family, and any funds garnered from these are used to donate kits to families in need and provide more services to families. So an example of the money being used would be translating our materials into other language. We do not stand to benefit in any way personally from the sale of kits, and freely teach others how to make kits using our material at no cost. We want you to be able to define antenatal hand expression, identify the benefits for the family and the healthcare system, and recognize opportunities for implementation of hand expression across the care continuum. So what is More Milk Sooner? It has formed a lot more since 2019 when Heather and I were sitting together in Yellowknife. But what we have put together is basically a website with all the tools necessary to implement hand expression. So there's written resources, there's videos for families with myself, and there's videos for healthcare practitioners with Dr. Prolius. This is such an important part of the work we have done to elevate this, because Dr. Prolius is a very, very respected OBGYN, and sometimes people need to hear it from peer level. And so by committing to doing these videos, he has made it more available. Our most watched Dr. Prolius video is contraindications to prenatal hand expression. And I get that, because it's just nice to hear what a senior fellow of obstetrics would say about who shouldn't do this. And we are also placed to learn to make or purchase colostrum collection kits. So we're a grassroots organization started in North Battleford with dedicated to families helping to achieve their infant feeding goals. We do not receive any funding from commercial sources. And why do we do this? We do this because we love it. It's important work, and it is life-changing work. It is, so the only payment we get from this is just the feel of having easier starting and continuing breastfeeding. So we want to educate you about first hour breast stimulation and reduce barriers to this occurring. And we want you to become the local advocate for antenatal, prenatal hand expressed, and we'll give you the tools to do it. It was very heartwarming for me to see in the comments people who are from communities where this is already up and going. And so I would love to know, if this is in your community, what your thoughts are at the end of the presentation. So myself, I am a registered nurse in lactation, and I'm going to share my stories of why hand expression is so important and why we need to start before baby is here. If this is something that you person who's like, I need a reference, we have validated and understand how important that is. And so on our website, under research studies reference list, there's a whole reference list about the references used in our presentation today. So what is hand expression? We hopefully at least all got a little bit of an idea of what it was when we were watching our both have had technical difficulties today. So hand expression, simply put, is exactly what we watched. It's using your hands to get milk out of the breast. There's nothing new about it. Women have done it throughout history to help feed their babies. So first hour hand expression is where our journey actually started. So we didn't stay, we just began to understand how important it was to have quality breast stimulation in the first hour. And why that is because our bodies are feedback organizers. All our body does, before even below our conscious brain, is work to keep us alive. So if you were to have a car accident, you're not going to have to tell your blood pressure to elevate, your heart rate to elevate, all of these things. Our body does all of these things to keep us safe and alive without us ever being aware. And labor and birth is very, very similar. So when a lady gives birth, it is very, very, in history, having a baby or being born were the two most dangerous times and likely times for people to not make it through delivery. And so throughout history, that was a time of life and death criticalness for moms and babies. And so our body became very, very smart, and within the first hour after birth was gathering information of if baby had survived delivery. And so that's the feedback that it's seeking in that first hour. So if you think of what birth was like 100 years ago, here in Saskatchewan, we actually have a museum that seeks to bring buildings in and house them that were present here 100 years ago. And when I was visiting the Western Development Museum, there's a funeral parlor that they moved in. And I was really interested in this funeral parlor because in it there was a display, and this display had it was a display to infant loss, and it had an empty doctor's bag. And what it was it was actually a display honoring the fact that it was so common for babies not to survive delivery 100 years ago that doctors would actually take a purposely empty doctor's bag to home deliveries because there was a good chance that they would maybe have to take that baby out who had not survived. So fast forward 100 years, thanks to the brilliance of obstetrics and the brilliance of what we can do to help babies get here more safely, we have made birth so much safer for mom and baby. But what we have done is sometimes interrupted what the body has come over all of its learning to go, did baby make it? And that is quality breast stimulation in the first hour is the only way for body to know that baby survived. So in this study, what they did is a lot of our breastfeeding research, as you know, is done with prenatal moms who nobody can have their baby because it would be highly unethical to put babies into groups of you can have skin to skin and not skin to skin. So in this group, what they did is they took all mummies whose babies came too soon and they put them into two groups. And one group started hand expression within the first hour. The other group started hand expression in the second hour. And what they found is that the group who started in the first hour was able to harvest 4.19 mils of colostrum. So it's a huge amount of colostrum, especially when you think oral immune therapy for our neonates is often 0.1 of a mil. That's a huge amount that we're sending these babies to the NICU with. But the interesting thing that this so beautifully articulates is how the mums who started in the 1st to 6th hour were on average able to harvest 0.1 mils of colostrum. So already you can see where the body has shifted and said, I don't know that this baby has made it. And when they followed these mums for the next 6 weeks, what they found was that the group who had done hand expression within the 1st hour had 130% more milk than the mums who had started in the 1st to 6th hour after birth. So when you think of what our babies go through to get here, it is often, I like to tell the story in prenatal class of it's like coming from Jamaica and being dumped in cold and snowy Saskatchewan. So you think of where our babies are at. And you think they're in this nice warm uterus, they're floating around in salt water that's 37 above. They have this concierge placenta who does all the work for them. They do not have to eat on their own, sleep on their own, pee on their own. Every need they have is literally taken care of by this butler placenta that is taking care of them. And then they're going on a long bumpy plane ride because remembering that they go through the birth process too, and then are dumped in an environment that is 20 degrees colder than where they had just come from. So here, well, in most across Canada, we have 0 degrees Celsius days. And so when I say, if you'd like to know what your baby goes through being born, you can go outside after a shower on a 0 degree day. So that is outside naked, sorry. So you have to be naked when you're doing this. And you have to have a shower so you're wet. And then if you go from your shower outside, you're doing a 20 degree temperature drop, which is what our babies go through. And so that helps parents really understand why skin to skin is so helpful to those babies. But in order for us to conceptualize what babies go through and the difference of parents who are actively helping feed versus not understanding that they might have an active role in breastfeeding, is basically if we were all to think of jumping on an airplane, going to the middle of Europe where nobody speaks our language and it can get very, very cold. And we are getting there after a long bumpy plane ride and we're very, very tired. And we're going to be offered 2 tour guides. And so the first tour guide is going to say, welcome. We were told in all the books we read that you would know how to find food when you got here. And the second tour guide is going to say to us, welcome, you must be tired after your long flight. We're going to make sure that you have something to eat in this next hour. And over the next 2 or 3 days, you and I are going to learn to find food together. And all the while, I'm going to continue giving you snacks because nobody is a better learner when they're hungry. And so this is the difference in the messaging that we do of baby is going to be able to solely initiate breastfeeding and be okay, or we expect that most babies are going to need help to learn the skill of breastfeeding. And that's where hand expression comes in. Oh, I should have done an informal poll. Should ask people if they would like to go with tour guide 1 or 2. Most everybody I've ever talked to wants to go with tour guide 2, including me, because I like snacks. So we really can empathize that our babies probably want more of that experience as they come. So we know that we cannot always control what happens in the first hour of birth. So when possible, we must move into the prenatal period. And this is where we really, really scaled it here in Saskatchewan. So is it safe? I'm going to give you this perspective, and then I'm going to present the research perspective in a couple of slides, because if Dr. Perlius had been here, he would do that. So I'm going to give you the more broad thoughts on this. And there's 2 groups who have advocated for prenatal hand expression since a long, long time ago. One is the gestational diabetics. We know that insulin has a role to play in milk coming in. And so when women have gestational diabetes, they're more at risk, or diabetes in pregnancy, they're more at risk for a delay in their milk coming in. So they have for years gone, it makes sense to have some colostrum stored so that if baby needs some extra, we have it. And what they have said is they've advocated from a perspective that throughout history, women have breastfed through subsequent pregnancies because it's a form of food security for that older child. Tandem feeding, we know, very, very normal in parts of the world. So we have subsequent breastfeeding through subsequent pregnancies. And so if you can breastfeed a baby, why couldn't you use your hands to get a little bit of colostrum out? The other group who advocates for this very heavily is groups like who expect that they might struggle with supply. So groups that have a previous history of breast surgery, PCOS mums, and their perspective on it is that if a woman is cleared to have sex, she should be cleared to do prenatal hand expression, because there's a heck of a lot more oxytocin in the cervix or in the act of having sex and an orgasm than there is in a little bit of hand expression. So everybody cue laughter on that one. If we were together, we could have a good chuckle. So we like to talk about this at prenatal classes, assessment units, labor and delivery. We are so, so unique here in Saskatchewan that this has been led by our obstetrics team. So it's available pretty much throughout the whole province, and it is obstetrics offices that are driving this by having this conversation with mums at 35, 36 weeks and encouraging them and providing them the resources of the kits to do this. Every prenatal class is cool, and even in our labor and delivery unit, it is, if you present for induction, you will be talked to, even if you haven't done previous prenatal hand expression, about how much the body loves its own oxytocin. And one of the easy ways to get some oxytocin and maybe even harvest some colostrum is to do some hand expression. So we are seeing this from our residents, from our OBs, from our nurses. We really have, and that's our hope, to inspire other places to go. So it is an insurance policy. We are suggesting that low risk pregnancies who are safe to do this. And so we are suggesting this for a wide population. We are hoping that the vast majority of mums do not need to use the colostrum they've expressed. But if they do, it's just like how we buy insurance. You buy insurance hoping not to need it. Our favorite thing is when a mom goes home from the hospital and maybe hasn't used any of her colostrum, but it's because she's dripping colostrum and has all of this knowledge of how to use her hands to get milk out of the breast. So we like hands-on pumping here, which is just very, very simply when women squeeze their breasts, it gets more fat milk out and involves the body in saying that baby is here. And so in this, when they were studying the milk composition of mothers, the difference between women who squeezed their breasts while they pump and didn't squeeze their breasts was 2 to 3 times more fat content for the group who had done doing breast compressions with that. So it's just like an easy and cheap and free. And that's like the beauty of this. It's owned by the moms. It's owned by the families. It's simple. It's just wonderful. So I am now going to explain to you how our OBs do this in their practice and how I do this in my practice. So our OBs usually talk about it at obstetrics. So Dr. Prolius actually starts at 28 weeks and he'll give the mom the kit and he'll say, go home. You don't need to start this, but I want you to start learning this information. And we're going to start it at about 36 weeks. The really interesting thing about this is it primes mom to know how important first hour hand expression is should she deliver early. So one of our favorite stories is that a mom saw Dr. Prolius at 28 weeks, went on to deliver early, had phoned her mother to go to her house to get her hand expression kit so that she could hand express for her new baby. And I just think that is why this is so cool, because like in a hospital where we know we have syringes everywhere and could make do to get this mom what she needed, that was something she viewed as hers and hers alone to contribute. And she had the tools necessary to do it. And so it's just a beautiful thing of how it really provided safety for that mom. A lot of our other doctors, including Dr. Yen, will talk about it at the 35-week because always we need to tie things together. So if you're a new clinic, what I often say is at 35 weeks, we usually do the GBS swab here. I'm assuming that's similar across the country. And so when the GBS swab is being set up, a More Milk Sooner kit will be placed. And that's a cue to the doctor to give it to the patient to say, go get familiar with this information and we're going to talk about it in the weeks to come. So here we start at 36 weeks in low risk pregnancies, but there's not a wrong place to start. So some places you have to build up your comfort level with this. And so some places when they start at 37 weeks, and there's nothing wrong with that. It's just that we do know the longer a woman has to practice, the more chances she's going to have with success. And so, but what if I don't know what to say to my patients? And so the very cool thing is that we have created a way for this to flow with very little interaction about it. And that's our favorite thing from our RBs is that we have created with these kits standardized, really great information with a website and videos to back this up and complete understanding. And so even in high volume obstetrics practices, they say, take this home, read this. If you have questions, we'll discuss it next week. And so it helps to bring confidence because they know that all of the questions are going to be answered on the website. And often moms don't have any questions. So it's just a really beautiful way to go about it. And even if you just send people to our website, they will have a wonderful idea as to why it is so amazing. So we had those two historical perspectives on how could we suggest that women do this in pregnancy. Then the Australian Breastfeeding Committee sponsored a study where they actually looked at the outcomes of babies who had to whose mums had done prenatal hand expression because they had diabetes in pregnancy. And what they found was that there was no harm in advising women with diabetes in pregnancy at low risk of complications to express breast milk from 36 weeks gestation. So along with this, it also is such a loved program. A lot of families have stress about not having enough breast milk. And I believe that that's in our genetics because with what's happened in our country in the last 100 years with formula, that often everyone will have a first degree relative who did struggle with breast milk. And so feeling like you're doing something, learning the skills to do it in a non-stress environment. If you have practiced it at home and you need to do it in the first hour after birth because baby's a bit sleepy, you guys are already so great at doing hand expression because they've had a chance to learn it at home. So it is just such life-giving work. So the one question we always get asked is, will there be colostrum after birth? Yes, we do not rob colostrum from the babies. The delivery of the placenta is what triggers lactogenesis too, and the breast will continue to make colostrum from at least 24 hours after delivery, which would be very more similar to other mammals in the mammal kingdom. So how soon milk comes in and how much milk comes in is directly related to quality breast stimulation. So that's where we've changed the game. 10 years ago, it would have been common for us to say, oh, babies are pretty sleepy in the first 24 hours. It doesn't really matter. And now the message has become, yes, they're sleepy, but they also need to eat. And so if they're not willing to, or willing or able to do the work of breastfeeding, let's do hand expression. Dr. Jane Morton, who is like the guru of this work, she beautifully quotes, no harm comes from too much colostrum. All harm comes from too little colostrum. And so even if we're just safety and giving women the tools, and what I love is like we are all working to become baby friendly, and teaching women hand expression is one of those core values. And so here, this is like a step to it, and it's already done by the time they come to the hospital. So we did do kits, and we strongly believe in kits because we strongly believe that we needed to not have mixed messaging. So these are called colostrum collectors. When we first put our kits together, we're very lucky because we have a patient and family advisory committee. And so I took about 10 different options for collecting to them, and they all picked this option. And why they picked it is it's very cute because, of course, I'm very passionate about this. And I was talking to this one family, like, what intrigues you about this product? And the mom says, well, like, we know hand expression is a thing because you're really passionate about it, but it was also really cool to have a product that was called a colostrum collector because it made it seem like this was really a thing. And so I love these. They're available through Mother's Choice here in Canada. So what the value of standardized kits does is it standardizes information. It makes it time efficient and empowering for our OB families. It's best practice for labeling and storage. The most expensive part of our kit is the stickers. And what do the stickers do? They comply with best practice for labeling and storage of a bodily human fluid in hospital when it comes into the hospital. They create curiosity. They give people the tools to complete the job, and they decrease barriers. And mums love the kits, and doctors love them. They've been very well received. So we really, Dr. Perlius, I wish he was here so I could thank him again for this, but he really had the wisdom of going, we need to put this into study form so that it can be more palatable to more people. And so what he did was he designed a study, and I volunteered to be the research nurse on the study. So if you are in research, I have a whole new level of respect for you. I always had respect for research nurses, but now having been one, wow. But the study that he put together was very brilliant. And what we did was we took mums who had had the ability to practice prenatal hand expression for 10 days, and we compared to families who had not practiced prenatal hand expression at all or less than 10 days. And we are comparing breastfeeding rates at 24 hours after birth and at 2 months. So all of the data is complete, and it is now being analyzed, and we are so excited to be sharing that in the upcoming months. That was a complete labor of love, and it's very exciting. So we have really cool QR codes. We have posters. We have all sorts of things that we will send you for free to help out this work. We also, again, do the cost recovery for our kits. I have 2 wonderful volunteers who voluntarily make the kits for me, which helps us offer them at smaller rates. So I also, because I am so passionate with this work, I offer mentorship opportunities, and it's just 90 minutes where we discuss what you want to talk about. So it's great for nurses, physicians, midwives, doulas, and it's free. It's just something that I do because I love connecting with other people. And so I want to put it out there that our support doesn't end here. And if this is where something that you would like in your area and you'd even just want to talk about it more, there's a place and a space for us to support that. So again, I invite you to connect with us. I invite you to take a picture of this page if that's something that's easiest for you. And the other QR code will give you, it takes you to our YouTube site, which is really cool. And I just looked this morning, and it's so exciting because our video on prenatal hand expression has almost 100,000 views, and our video on hand expression is sitting at 25,000 views. And what the Children's Hospital here in Saskatoon did is they downloaded all of our videos onto their computer or onto their TVs that they have in their room. And one thing I learned through the study is that the moms really like the videos. And so we really support, we just are total breastfeeding supporters. So go ahead with the first question, Heather.
There are a lot of, oh, can you hear,
I can hear you.
Myself? Is there a little bit of feedback on my end, or is it just?
No, I'm
no,
okay.
Perfect. All right. There are a lot of great. There are a lot of, positive comments around some of the things that you've said. So everyone's resonating and really, really appreciative of the perspective and the little nuggets of information. And I enjoy it as well. The little tidbits of information that you can take with you and the perspectives that you offer through the presentation. So we're very much appreciative of that. One of the questions comes along the syringe cap. So the product itself that you showed on the screen, what looks to be a syringe, the colostrum collectors itself, the purple. Someone is asking about the syringe cap, but I believe it's the product in itself. The whole thing, the syringe, the collector, and the purple cap itself is one product?
That is correct. So it comes, and then the nice thing about that is that it is a need for our NICUs to have sterile. If a baby was to go to the NICU, the purple color actually coordinates with international feeding colors in the NICU, and then so that's why it's purple. And then the sterile is really important because obviously we're dealing with neonates, and we don't really know. Obviously, we don't get babies to the NICU because we're not starting this work till 36 weeks plus, but babies for prematurity, but we do get babies who are having health struggles, obviously go to the NICU. So I am very happy for that. So I am going to come back to you guys because I just love to see faces if I can. So it does come with the cap. And it comes in a sterile sleeve. So like we would see most of our things come.
And where exactly, the other question would be, sorry, I believe someone else is asking a question. So I'll stop right after this question, let the other person talk, Naida. Some people are saying that they have problems or having difficulty sourcing that product. Where would you find it?
If you're having issues, you could email me and I can put you in touch with the company that we use, and that I can definitely support in that way. Mother's Choice is in most provinces, and they are the ones that I get it through. But so if you were to Google Mother's Choice products, you can contact your rep and you can get them. And they're very cost effective considering that they they have the cap and are sterile. I think they're about 41 cents a syringe at the moment.
Was there another question that someone wanted to ask before I move on to the next? Because I think I may have interrupted somebody. Was there an actual question that someone wanted to hop on and ask?
Heather, Leah's got her hand up.
Okay, I can't see the hand. Thank you, Pam. Leah, go ahead.
Oh, thanks, Pam. Hi, it's Leah Geiger. I'm the Provincial Clinical Coordinator for Maternal Infant Health in BC. And I really think your videos and resources are excellent. One of the drawbacks for me linking to them at a provincial level is due to the profit. And it was really good to learn about what you're doing regarding the profit and how it's contributing. So my ask would be to include that on your website. Because then that would be more likely for me to be able to link to that resource. But if there's a profit, then I can't push to that because that's endorsement, as we know, right? So if you could include a rider, if you could include a rider or something related to where the fees are going and how it's being utilized and supported, I think that would be amazing. And it's just really great to know personally that that's what's happening. And but I think that because your videos are excellent, so I would love to utilize them. So that would be my ask if that's possible.
Absolutely, and such a good point. So and very easy to do. So yeah, thank you for that valuable insight. And why we even sell kits is just simply because we created the need and the want for them, and there's still many moms who maybe their doctors talk to them about it and they just would like the appropriate product. Like it is also a labor of love, but you are right, communicating that better would be helpful to more people. So thank you, Leah.
Awesome. The next question is, what are your breastfeeding rates? Across Ontario, we are trying to increase our breastfeeding rates. This collaboration with the OBs starting prenatally must have a huge impact on your breastfeeding rates. And that's from Angela.
So I am going to defer on that one, and I would love for you to revisit, like the concept that I'd like to revisit is our research, because what our research did was pull out if a woman has had an opportunity to practice this. We strongly believe that just learning is not enough. And there's a study that's going in Australia in tandem with ours that's really cool, where they just did teaching about it. They didn't follow up with if women had actually practiced it. And I really feel the practicing it, similar to if we were going to learn to ride a bike or anything. It's one thing to watch a video about it, but it's a huge difference to have practiced it 10 times than it is if we're just riding a bike. So, or if we're just watching a video. So our breastfeeding rates, I don't know that we're at the point, because we have just like, I think I would just like to wait until our study, because those are the rates that I would find very, very interesting, of like people who didn't have this intervention, where our overall rates have everybody all mixed in. And so I don't think it's as strong evidence. So good question on that one.
There are some questions about OBS buy-in, and personally, that's personally relevant for me too. Just the comment that how wonderful it is that you have had that buy-in from the OBS profession as well, and to be in collaboration together with this project.
Mm-hmm.
Go ahead.
Mm-hmm. So thank you for that wonderful question. How we have had success, Nova Scotia, you have some Nova Scotia nurses on here, I think, and maybe some doctors. We've done grand rounds to Nova Scotia, and I really think that doing grand rounds, which is obstetric space, was a really good way to roll it out. The other thing that I really want to appeal to is the fact that obstetricians in our province see all moms at 6 weeks. I'm assuming that's similar across Canada. So they are very bought in to the fact that even if they talked about breastfeeding prenatally, there's a lot of women who didn't have success. And so they see what we sometimes see when we work in homes of how much it doesn't work. What we sometimes are currently doing around breastfeeding education. And so saying, here's a tool you can do that's already ready to go, and appealing to that, like we all don't enjoy it when a mom is struggling at 6 weeks. And this is something that can, and actually then it really becomes blooming, because moms are so complimentary of their doctors when their doctors have introduced them to this, because it changed their breastfeeding trajectory. And then it gets into your community. And so when it's community level, as we are here in North Battleford, it becomes a thing that actually by the time Dr. Yen, North Battleford was the start of it, and North Battleford is where Dr. Yen does. By the time she brings it up at 35 weeks, almost 100% of the moms in her practice are going, well, I was waiting for you to talk about this. It's not news to anyone, because it spreads through like wildfire, because people are afraid of not having enough milk. So I would engage with your OB people who have grand rounds, and then I would suggest that Dr. Prolius and Dr. Yen and I maybe do the grand rounds for your province or your area, or even team meetings is a good way. And that's how we have had success here.
Excellent. Thank you, Naida. I will most likely be taking you up on that offer for my province. The other question, I'm just scrolling through here. Hopefully there are no hands up that I've missed. How many syringes come in a kit?
Oh, 3. And thank you for that question. So 3, is this going to lead us to that we really need to revamp our kits? Because one thing I was able to track in the study was how much were moms able to produce. And there was some moms, research before this was fairly limited on the amounts, and research was suggesting 0 to 5 mils was the common amount a mom would do the whole time she was doing prenatal hand expression. For our prime mums, we usually find that there's a week where they're just doing the massage and learning about their breasts, that they don't actually get any collectible volume. So we went with 3 because it was the middle of the research we had going forward. When a woman is done at 10 days, often they are north of collecting 3 mils. And so it's a dilemma that we are talking about currently, because we also have seen there's been other kits that have kind of come on the market, and some of them have more syringes in them. But our parent experience is that if you give somebody 10 syringes and then they're able to collect 0 mils, which is still the reality for some prenatal mums, it sets in their mind that the norm is 10.
Right.
And so it's that balancing act of what we do of like, yes, 3 mils is super, super helpful, but it's not also, if you're not able to collect a drop, it's still very, very not as disheartening as like many more syringes. And so often what our docs will do here is a mom could they'll provide the first one free of charge, and then moms can purchase extra kits if they need the extra syringes. I see that changing in the future because moms just really enjoy these syringes. So we're looking at how do we make them more available. But at the same time, at the point where a mom has collected more than 3, if she just keeps doing hand expression, that's the key. So we do Dr. Perlius went up north over Christmas, actually. I was calling him Reverse Santa because he was taking really good care up north to our moms up north. And like there, it's a huge transportation issue because a lot of women have to leave their home and so our message for those moms is like, don't even worry about collecting it, just make sure you're doing it. And that's the message. So yes, the kits are wonderful. The kits are great, but that collecting it really is the cherry on top of the ice cream sundae of awesomeness that just doing prenatal hand expression is. So long answer, but great question.
Yeah, great answer as well, Naida. The next is a comment that doulas can play a huge role in promoting and supporting this care.
Oh, yes. I love doulas because their perspective is that or like the doulas I've talked to, I shouldn't say like all doulas, but what I really love is just how much more empowered women can feel when they've had interactions with doulas. And so this is, again, part of that empowerment and part of that teaching, and that like doulas regularly talk about this in our home communities.
Last question, because we're nearing the end, and I do need we've got 4 minutes left, and I just have a few minutes at the end to just remind everyone of a couple items. But the question is, how much hand expression in the first hour are you encouraging? Did the moms in the 1 to 6 hours have the same birth experience?
So those were not our studies. Those were studies taken out of, I believe, perinatal med, but they would have had fairly similar experience and everybody would have been removed. So nobody had their baby with them first. If you're asking what we would suggest at our own hospital, if a baby by a half hour is still really exhausted and had some birth trauma, so if you're thinking your forceps assisted or your vaginal assist birth or your vacuum assisted birth, we are saying that like by half an hour, we want you to start hand expressing, and even 10 minutes, like it was really interesting because in the States, they really wanted a time limit. But the thing is that everybody's body is different as far as to how soon it will respond to hand expression. So a mom who's done 4 weeks of hand expression before she's had this baby, and this baby's just had some birth trauma and is a bit sleepy, in 5 minutes, she might collect all she needs and more to feed this baby. So what I always say is like the point is to stimulate the breast, but also feed the baby. And so for some moms, that process is going to be very quick. But for other moms, it might take up to 10 minutes of bouncing back and forth in between breasts to get any collectible volume to then put into baby. So it's that's kind of what we suggest here. And the good thing is that because it's so mom and baby led, like Dr. Prolius is so beautiful in this, but he always teaches to the partner as well. And if he has a mom who's having a difficult delivery, then he's saying to the partner or support person, you're going to have to help with hand expression this first hour because this mom and this baby are exhausted. So it's just another tool, and then it's just beautiful all around. So I'm going to stop talking because you have to do our presentation questions.
Yeah, so you'll see, I do see another hand up, but I'm just in case, Naida, if we want to stick on for the person who is
I
asking
want
the
to
question.
stick on after, yes, but I understand some people will have to leave.
Once again, thank you, Naida, and so nice to reconnect with you virtually after all these years. Really, really, really thankful for your perspective and your work, the work of your group, the work that you're doing. It's so important. And a reminder to everyone, thank you again. And I hope you're able to attend the other sessions this week. But please, you will see that the link to the evaluation is posted in the chat box. Please, in order to receive your certificate of attendance, you would have to complete this evaluation form.